Hi, this is Dr. Rene Amaya with Amaya Wound Healing and Aesthetics, and today I'm joined by my fabulous nurse injector, Jamie.
Hello.
And today we're going to be going over common questions that arise with our aesthetic procedures. So Jamie, I get a lot of questions regarding what we do here in the office, what kind of complications arise, how do you actually do it, what are we doing, and I thought it'd be a good opportunity to review some common questions that people ask regarding these procedures.
I like it. We're all about education here, so let's get started.
So one of the most common questions I always hear is, what really is the difference between Botox and a filler?
Okay, so Botox is a neuromodulator. We inject it into the muscle. It helps with relaxation of the muscles and diminishes the look of your wrinkles. And the fillers, they're more like a gel product that we inject, and that helps smooth out the lines and make you have more of a youthful appearance. It goes a little deeper into the skin, whereas the Botox goes into the muscle.
So Jamie, where is Botox injected in the face for aesthetic purposes?
Okay, so Botox is FDA approved for the most common places people have the wrinkles in their face, which is the 11 lines, their forehead, and their crow's feet.
So I know a lot of people are nervous about needles and being poked on the face. They're scared about pain. Is this really a painful procedure?
For the most part, the pain is very minimal. Everyone tolerates it really well for the most part. It is a needle going into the skin, so you do have just a little sting, but after that, you really don't feel much after that. We want you to be as comfortable as possible here, so we do have techniques that can help if that is something that you're worried about. We can always do a topical numbing cream, an ice pack, whatever to make you feel comfortable here.
Do most people need something like that?
Not really. Once again, it is very minimal.
Okay, great. Now what about bleeding? I know people are scared about needles in the face and my face is going to be all bloody. Is that common with Botox?
Not really. You will have minimal bleeding sometimes. It is, once again, a needle going into the face. Most of the time it's very minimal, maybe like a little dot of blood that we just wipe away with a little cotton ball.
So no actually bloody face or
No.
anything like that, right? No, just a little dot.
Just a little dot.
Right, good, okay. Jamie, a lot of people are worried about having lack of expression or having like a plastic looking face after their treatment. What do you say about that?
That is a big concern for a lot of people. It shouldn't be a worry for people if you're in the right hands. You need an injector that uses the FDA guidelines and protocols. As you can see here, I injected Dr. Amaya about 3 weeks ago, and he still has full expression of his face. I have also been injected, and I can still make expressions. So it shouldn't be a worry when you're in the right hands.
Fantastic. So Jamie, a lot of people ask me, how long will the effects of Botox last? Are we talking weeks, months, years? How long does it work?
So usually about 4 months for the Botox. People come back in about 4 months. Some people are a little less, some people are a little more, but we recommend the 4 months. That's usually a good maintenance for people.
So meaning roughly at 4 months, I'd start seeing some of the muscle relaxation wearing off, having a lot more, the wrinkles coming back.
Yes, that's correct.
Okay. So Jamie, it sounds like Botox is this amazing procedure we offer here, but is there somebody who really shouldn't get Botox?
There are a few. So anybody that's pregnant or breastfeeding, has a neurological disorder that affects muscle movement, probably shouldn't be getting the Botox. If you're worried or have any concerns, you can always come in for a consultation and we can talk about it then.
Okay. So Jamie, what about aftercare? Is there anything I should be doing immediately after or long term? Is there anything that I shouldn't be doing or should be doing after my treatment?
So aftercare is very simple. Most people end up going right back to work after the injection. You have small little bumps right after the injection, usually goes away in about 30 minutes by the time you get back to work. The main things you want to avoid is bending over for an extended period of time. For 4 hours, you can bend over to pick something up. You just don't want to stay bent over. No ball cap for 4 hours, strenuous exercise for 4 hours, and no massages for 4 hours.
Got it. So basically, skip the gym and no facial massage where I've received my injection.
Yes, that is correct.
What about if makeup or sunscreen or being out in the sun, does that have any effect? Do I need to worry about that?
No, you can reapply your makeup or moisturizer sunscreen right after the procedure. You just don't want to really be rubbing. Just reapply and be done with it for the 4 hours.
Great. Okay.